I'm 24 years old, looking to get my look back. Any suggestions for hair transplant? I need to get my hair back with transplant and gain back my confidence.
Thank you for your question. You're 24 years old, and in your question, you're stating you need a hair transplant and you want to get back your confidence. The photos you submitted are great. These are the types of photos that allow someone like myself to really understand the degree of your hair loss. Now, it is completely understandable that you have this belief that a hair transplant is the right thing for you because you're losing so much hair and it is affecting your confidence. It's very important for you to understand before you have a hair transplant what the limits are of a hair transplant. I'm a board-certified cosmetic surgeon and I specialize in hair transplant surgery, and I've been doing this for over 20 years. We have developed a different alternative for hair transplantation, which I'll discuss with you, but I'd like to frame for you how we assess a patient like you when someone like yourself comes to our practice. Understand that at 24 years old, you're actually in the minority of men who are losing hair. In other words, there is a rule of decades. In your 20s, only 20% of your contemporaries have any kind of hair loss, while more than 80% have a lot of hair. Your family history is probably where this is coming from. Genetics of hair loss, there are 11 chromosome locations, including the X chromosome, where hair loss genes are passed down in families. So understanding that the level of your hair loss in your 20s with the photo you submitted is very significant. I would classify it as severe. When you have that much hair loss, you have to understand that there is no hair transplant that could ever replace the volume of hair that you have lost. It's very important to understand that the permanent zone of hair that is used for transplantation is a very narrow band in the back of the scalp. Hair transplant surgery has become such an industry that has distorted the reality of hair loss such that it's become more about the sale of transplant surgeries than it is about finding solutions for individual patients. Now, this is not to say that all hair transplant doctors think that way, but when you look at advertising for hair transplant surgery, it is unfortunately very deceptive in the expectations of results. It is such that in the International Society of Hair Restoration Surgery in the United States has actually compiled data from its members and found that 65% of patients desired more density after they had surgery. If you were, for example, someone in your 40s and you had the same situation that you're in now, a hair transplant done in a more limited way would probably be acceptable because in your 40s and 50s, more than 40 to 50% of men have hair loss. Therefore, having just a little bit of hair in the center would maybe an acceptable result. We've seen many patients who started having surgery in their 20s but didn't understand that their hair loss was going to continue, and now they only have our grafts, and eventually they go back to having transplants, and eventually they don't have that much density, and they try to fill their whole scalp and they look like they're losing hair. So it's very important that you understand how much a hair transplant can achieve. Now, there are medical options that you should be aware of. The two drugs that we use in the United States that are indicated for hair loss are finasteride, which is an oral drug, and minoxidil, which is a topical drug that's available over the counter. Although in situations like that you have, finasteride may or may not be helpful. If you look up finasteride, you might find, or you probably will find, a lot of concerns of long-term sexual side effects. It's such that the majority of men who come to our practice do not want to take finasteride. Minoxidil may be of limited value because in someone like yourself where there is this rapid progression, minoxidil won't stop the progression of hair loss, nor will it provide enough volume to create the appearance of no hair loss. In our practice, we developed a treatment called hair regeneration. And what we have developed is the application of a wound healing material called acellular matrix that we originally used for treatment of wound healing in facial cosmetic surgery and body cosmetic surgery, in addition to the wound healing of hair transplant surgery, specifically for the hair grafts in the donor area. And it was discovered that the hairs that were thinning actually became thicker. So what we've developed is a treatment where we combine a material from your own blood called platelet-rich plasma with extracellular matrix, and we do an injection. What we have found is that the results with this injection for the patients who respond well actually far exceeds the results of hair transplantation. Existing thinning hairs actually become traumatized from the placement of incisions into the scalp to place the grafts, and that trauma causes collateral hair loss. And when we do this injection, we're actually stopping the progression of hair thinning and making hair thicker, thereby creating much more volume effect because the hairs are already present. Hair thinning is a progression where thick hairs with every subsequent growth cycle become thinner. So with thinning hairs becoming thicker, the coverage is very dramatic. Now, it doesn't necessarily mean that you're going to get back what you had. What we say is we can save the dying, but we can't bring back the dead. The hair that is thinning and then a lot of hair that may be actually dormant will respond and grow. And we follow our patients for a year to 18 months, and we follow every 3 months with standardized digital photography and microscopic photos to make sure that our patients do well. And even although we have anywhere from 30 to 50% of our patients come from all over the world to have this treatment, we follow our patients very closely via Skype and other ways, and we're constantly getting emails of photos to watch people's progress. The point is that there is a non-surgical alternative to hair transplant. Doesn't mean hair transplant is out of the question, but I would counsel someone in their 20s to wait and do something non-surgical first to try to restore as much volume as possible, and then understand the limits of a hair transplant before moving forward, making an informed decision. Remember, the limits are based on the number of hairs that you can get from the back of the scalp. There are many doctors who are promoting mega sessions and robots and various types of devices, but none of this in any way changes the physiologic limitations of the donor area. In fact, a lot of people are knowingly taking hair grafts outside of the limited donor area in follicular unit extraction transplants above and below that area to create volume, hoping probably that maybe there'll be some type of way to prevent those hairs from falling out in the future. What we do in our practice is we actually encourage people who have had FUEs or FUTs done elsewhere to come in and have the injection, because we found that we can help the healing process of the grafts, we can help the healing process of the donor area, and we can help the thickening of the existing thinning hair so that the overall result looks that much better. We don't mind that their transplant surgeons take credit for such a great result, but it really helps the patients who realize when they understand what they've gone through and want to hold on to what they have. So in summary, before you move forward with a transplant, learn about the non-surgical options, the medical options, and this new stem cell-based wound healing technology we've developed called hair regeneration before committing to surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.